Well, this is one bad one. We'll take that out, okay? We'll take that silver amalgam filling out, but the rest you got no problem with. This is my findings. I purchased a $10,000 piece of equipment called the Jerome Mercury Vapor Analyzer to test this stuff out myself. And I found out that on everybody, except 2 people who are using the violet flame continually, which evidently has some transmutational value on their silver amalgam, that in every other single person, we tested several hundred of these people, they all had a high degree of mercury in the free form in the oral cavity, which was brought about by the compression factor of chewing. Now this we know. And as soon as they had the silver amalgam out of their teeth, many of their symptoms disappeared immediately. For myself, the first 50 years of my life, my hands shook like that. I think Doug recalls when he first met me, I still had a little tremor left until I got all the silver amalgam out of my teeth. At that time, I no longer had cancer. I had cancer 3 times in my life, and I couldn't figure out why it kept coming back. I would go on a heavy program, the cancer would go, then it would come back again. As soon as I got the silver amalgam out of my teeth, I was able to lick these life-threatening situations, okay? Now those of you who can't have silver amalgam in your teeth, and you're trying to go on a program to beat cancer, you're putting the cart before the horse. The first thing you should do is get that silver amalgam out of your teeth. Very first thing. Because that destroys the immune system, and as long as you have that in your body, it's going to counter the very thing you want to do, which is to build the immune system. Now you can't build it temporarily, but you got to attack the problem at the root of the tree, so to speak. And you get to the root of the thing, get the silver amalgam out, and do what you have to do it. You may lose a tooth or 2 in the process. That's the way it is. Okay? But get that silver amalgam out of your teeth first. Now the books are here for your information, the method of getting the silver amalgam out. Don't just get them out according to the, just the ones that are going to be electrically stimulated, so to speak, and have a high reading. Get them all out. Okay.
There is a group of dentists in Australia who have formed a society. They don't use any amalgams or do root canal fillings.
Speak louder, point.
Right. I have some pamphlets which they printed, and it actually shows the correct way, the procedure of removing amalgams and different points on mercury toxicity.
Thank you. Check with this little lady, get all the addresses you can, and get the information, and get only the dentists that use the rubber dam to keep the mercury from going down your throat, and use only that, the dentists that will, shall we say, be sympathetic to alternative medicine. Let the rest rot on the vine.
I like that priority. Now I see a few frowns coming my way. Would you like to tell me what they're about? Is it the fans? Okay. Does anyone want this fan on over here?
We like this one off.
You'd like that one off?
How many want this one off? Off, over here.
Oh.
1 person only wants this one off.
2?
This one.
Yeah.
I got 3. Okay, you're outnumbered, mate.
We can't hear in the back, but with the fans on.
How many cannot hear in the back with the fans on?
I had all my amalgams out by a trained dentist in Perth who went to the States to train in this method, and as I spoke to him through the treatment, he said to me that he didn't believe this. He was doing it because there was money in it right now, and I took his advice, and I ended up with a bridge and a big gold cap, and I now believe that we shouldn't have any metal in our mouth. So if you're going to, have your amalgams out, really look into what you want used and put in your mouth.
Awesome.
Because it's very expensive when you start having bridges and crowns and etc. So I'm saying find out what you want in your mouth before you have your amalgams, as you're having your amalgams taken out.
Yes, how does gold affect you?
Gold can be a metal, which if you have metal and a silver amalgam in the mouth at the same time, you have two dissimilar metals affecting the meridians that affect certain teeth and then will affect through the body by reflex action different organs of the body depending on which teeth are affected. The gold in the mouth will also interfere when we're working on a resonant frequency level, trying to get the body to operate at 8 hertz. There will be an interference there. But even the gold, you'll have different formations of gold in the complex of the alloy that they use, and even those two differing gold alloys will become a battery, which will become very, after a while, will break down the system in the corresponding areas.
Whenever you have more than one type of metal there in the mouth, which is what John's saying when he says dissimilar metals, this creates electric current. And even in a gold filling or a silver amalgam filling, within the filling itself you have dissimilar metals. I mean, the silver amalgam filling is made up of silver, mercury, tin, and a couple others usually. The gold filling is not solid gold. That would be far too soft. I mean, there's other metals right in that filling. So even just with one metal filling in the mouth, you already have dissimilar metals. So you have basically between the saliva and the dissimilar metals, you'll have current, and each one of your teeth, and we'll get into this more in the cranial week, each one of your teeth will affect different organs and glands in the body. There'll be different reflex along that meridian. And so basically the areas where you have the fillings, those are the areas that will reflex to your weaker organs and glands, and you'll have problems that, you know, you may have a tooth that affects your pancreas, for example, and so you're going to have pancreatic problems as a result of that filling.
6 years ago, I had a malignant cancer under my right arm removed, and I was doing a magnetic week in Kyle with Nicky Singer. And 3 women there told me that they were absolutely convinced that the breast cancer that they had was a direct result of their amalgam in their teeth. Now that was the first I'd heard of it, and I was very surprised. I then went to my dentist at Mount Eden Dental Surgery, for all the Aucklanders here, and virtually had a stand-up fight with him to get the amalgam out of my teeth. He was not very interested in hearing what I had to say and contested it strongly. Well, I stood my ground and had the amalgam taken out of my teeth. Remember, this was years ago. I then found John and Bernadette in Auckland, and Bernadette suggested that I have a panic done on my teeth in Auckland. And lo and behold, there was amalgam underneath my plastic fillings of some years ago that was still affecting my mouth. Of course, Bernadette introduced me to root canal, so I went to Sydney, to Rob Gammell in Sydney, actually 4 weeks ago, had another Panax done, and it's fascinating to find that the first dentist's intent and heart wasn't there, so therefore his job wasn't excellent in my experience. That's what happened. I've since had the amalgam removed, the root canal removed. The root canal was an absolute fascination. 195, but sorry, 264-5195.
And the name?
Robert Gamal, G-A-M-M-A-L, and no, he's not Indian. Right, there are a number of dentists having a 2-day conference on biocompatible dentistry in Australia, and I was fascinated and delighted to find that I'm leaving a bunch of pamphlets up here for those of you who may be able to assist this work by presenting this to dentists who might be interested. There's a conference, a 2-day conference at the Sydney Convention Centre, Saturday the 25th and 26th of February 1995, and the subject is amalgam, root canal therapy, osteitis and health. One more thing in the sky. Yes?
I didn't see any pencils moving on that. This is absolutely important for dentists to learn about the damaging effect of root canals upon the system. And this is one thing you're going to have to get into your system. Anita will talk to you in a few minutes on it. Now when Gary gives you this address, you encourage all of your dentists to go to this. It's absolutely imperative because this is, well, some of the very finest information on this particular problem will be resolved at that convention. Gary, give it to him again, please.
Yeah, sure, John. Well, John, what I'm going to do is leave a bunch of these pamphlets up here with all the information and the address and the time on it. I'd like to say one more thing about this, though. This guy, Rob Gamel, Bernadette, is a good friend of Bernadette's in Auckland, that's for the Aucklanders, has written a book on this subject, and he explained to me that he is too fearful to publish it right at this time because of the pressure that is being put on him by the Australian Dental Association. I appreciate that this is going on tape. He says that after this conference he may have the courage to let it become public. That is the sort of pressure that's on this sort of stuff. Thank you.
Here we go. 1 second.
Come on, Gary.
My counsel on this matter is bam the torpedoes and full speed ahead. Regardless of who you are or where you are, do what is right and take the consequences of right action. But do it with the preparation that you cannot in any way be faulted on.
I believe one of the best dentists in Australia is in Adelaide. If you're into getting your silver amalgams removed by the right person, Dr. Cow is the man to see. People come from all over the world to see this man. He's not into taking one that's more active than the other. He just rips the whole lot out. He is the dentist to see in Australia. K-O-W. I'll get you the phone number and address, which I haven't got with me at the moment. I'll write it up on the board next break.
Thank you.
I got my silver amalgam fillings out this morning. I had 2 on this side, 2 on that side. Took an hour and a half, cost me $338. He done everything what John said was correct in cans. So it's not there and it can be done here. Thank you.
Name, address, where was it, Nick? Details?
It was Rod Ashton and Associates, and they in Sheridan Street. Yeah, the bill was $238 for 2. Now this is what it says there: composite resin restoration 2 surface, whatever it is, positive teeth. Composite resin restoration 3. It's got an X behind that, and so there was 4, but he's got 5 here, so I don't know the other one yet. Thank you.
I have a question about teeth that have been smashed and therefore capped. What sort of effect does that have on organs, etc.?
The individual teeth will have reflex activity in the organs and glands. The reflex activity goes in both directions, actually, because you'll also tend to develop cavities and dental problems in the teeth that are reflexing to your already weak organs and glands. I mean, the reflexes, y'all follow that? The reflexes, like if you have a tooth that reflexes to your heart, if you develop problems in that tooth, it'll affect your heart, but also if you have problems in your heart, it'll affect that tooth. I mean, the reflexes will always go in both directions. The front 2 teeth right up there will be for the heart. Now, the question here is, what if you smash up a tooth and get a cap on it? Are you going to have some effect on the corresponding organs and glands? I would believe that there would still be some degree of effect, but part of the way that this entire system works is that it's actually the chewing that exercise, the chewing, the pressure that is exerted on the individual tooth structure by the chewing process. That's what stimulates and benefits the corresponding organs and glands. So if you had a tooth that was all smashed up and you didn't cap it, so you just had like a little stub down there so that when you were chewing there really wasn't any pressure on the stub, there would definitely be a negative effect on those organs and glands because there's no pressure on the stump. But if you get it capped properly so that things are meeting correctly, so now you're getting pressure on what's left of that tooth structure, that's certainly a whole lot better off than just having a little stump in there. So if you do happen to have a tooth smashed up, I would definitely recommend you see about getting it capped, but done without any kind of amalgam material or any other type of toxic material put in there.
Okay?
I have one more question.
Speak loud.
Um,
Speak loud.
I have one more question because of what was just spoken about. If you have a tooth and there's no corresponding tooth, such as if you have your wisdom teeth and there's no corresponding tooth, would it be better to take that tooth out or leave it there, as there's nothing to chomp onto?
You go to a dentist that is well imbued with this idea of correct principles on teeth and go according to his consultation in that regard. Make sure he is an alternative dentist that understands the things we're discussing now. You hang on.
Hey, excuse me, John. I asked him this morning to pull my 4 teeth out, and he said, no, I won't take out teeth that aren't required to be pulled out.
Good.
So he went against what, he gives correct principles on it.
Yes, it's important to go to a dentist that is aware of these things. I just had 2 of my white fillings replaced, and there was mercury underneath. So the dentist previously did not get all the mercury out. And here I thought I had all of it out, and now I just found out that I'm suffering from mercury toxicity. Yes. Now, I went to a dentist who did not have the proper equipment. And he didn't have the rubber dam, and he just had he didn't have the suction, nothing. And I wound up getting mercury poisoning. Now this has been very difficult for me to get out of my system. I came down with severe fever, pneumonia type symptoms, and all the muscles in my hands started pulling in like a claw. And I've gotten most of it back on my little fingers are still working on. But
go into detail what they look like. Show them. Show them how your fingers work. This is what happened with mercury poisoning for her. She just found this out from a health magazine just a few months ago as to what has been happening to other people where this has been happening. And her fingers were all clawed like this. Finally the 3rd finger came back, and then gradually the 2nd finger. We got this part of the little finger left to go. It's starting to come out now.
yeah, so it is important. I know a lot of people say, "I'll just go to any dentist." It's not like that. You should really have it done properly. The other thing I want to talk about is the root canals.
Yes, please.
I had 2 root canals. I had no pain in them. They looked perfectly good. I mean, they were beautiful. They looked like teeth, regular teeth. I had no problem with it at all. I had an x-ray done down in Tauranga in New Zealand, and underneath there was this black line which showed the abscess, the infection in there. Because those teeth do not have nerve supply, they do not have circulation going in there, and the bacteria is forming, the toxins are forming, and you can't feel it. You can't feel it because the nerves are not there. So I had to have those 2 pulled out, and also the infection in there. They take the drill, it's like a burr, and they have to go in there and they have to drill out that whole infection in the bone, because it starts to go right into the bone, right into the tendon. That bacteria and toxins start eating away in there. So the root canals are also very, very harmful, and you may not even know you have a problem until you go and get an x-ray done.
Do they fill up the root canal?
No, they just pull the whole tooth out, and the bone that's infected, they have to drill it. It's called a burr they use. It's they put it on the drill. It's kind of a thing which goes in there and really just cleans out that whole infection. It actually takes away part of the bone, and the bone has to regrow. It's pretty painful. It takes about a week before your face feels normal, even longer. I think Delwyn's going to speak more on it.
I want to say one thing. I've got a new lady. She's not the same woman she was a month ago. She just is not the same woman. All of a sudden, something has held back her progression, and ever since she had those 2 root canals out, she has just flowered amazingly. And frankly, I can't get over it because she's not the same person. Oh,
Yes. Also, on a more metaphysical level, when he was pulling out my root canals, I experienced what I saw, like in a part vision, was all these souls which were attached to the tooth. These entities which were attached because this is death in your body. This is a dead thing which is incorporated into your space, into your skin. They've taken the root canal teeth and they've embedded it under the skin of a rat, and the rat dies. And then they've taken that same tooth and embedded it in 100 other rats, and all those 100 rats died. So it's a dead thing which is being held within your body. And I saw that it was connected with all these entities that have word patterns of death. I just saw them all I kept sending them to the light as the guy was pulling my tooth out.
I'd just like to confirm what Trudy said about Dr. Cow. I'm a new person too. All that kerfuffle that I told you about, I think it was the first day that John...
Over it again.
Okay. I had osteitis in the jawbone, mercury poisoning, and I had breast cancer 2 years ago. Now, it just so happened that that area was on the breast meridian and on the heart meridian. I always had heart palpitations. When I first met you, John, I had heart palpitations. I haven't had one since. Now, and Dr. Cow said, in terms of material that you should have in your mouth, not even gold. It should be, Leanne, is it flaxite?
Yes.
And I had to actually fight to get the flaxite. I think I'm the only person in the whole of Australia that's got a cap made of just clear plastic and also a partial plate, just clear flaxite plastic. Anything tinted or gold or anything else just won't do. That's from Dr. Cow and Dr. Pullman in Adelaide. You've all heard of the drama I went through with the severing of the artery and...
No, I wasn't here day one, I haven't heard it.
Okay, the dentist was drilling through because I had osteitis, root canal. He was drilling through and all of a sudden blood went everywhere, all over him, all over me, all over the nerve, and he severed an artery. And he just fell backwards because he said, Derwin, I think you think this is bullshit. That's what he said to me. He said that this is just more than an ordinary osteitis operation here. So he took me into the office afterwards and he said that was definitely entity involvement. The entity just didn't want to come free. My heart was beating and I thought I was having a heart attack. And in fact the entity was dying when I thought I was dying. And I was in a big mess. My jaw went...
Say that again. Really, say that again. It didn't register in some areas.
The entity was dying as I thought. I felt I was dying. And I was actually saying to myself, I am dying, I am dying. And in fact, the entity was dying also. And when it came out, the dentist just, he said he used to faint at these things, but now he sort of pulls himself together and he can get through it. But it was quite an ordeal. But that was osteitis in the jawbone. And, I'm a new person. He hasn't got all the osteitis out, but the entity's gone. And I'm just, John and Anita will confirm that I'm a new person since I've had that done. It's just amazing. Even my face has changed. But this Dr. Cow in Adelaide, flaxite is the thing to have in your mouth. Yeah, Dr. Howard was the one with the entities. Yeah, flaxite, F-L-E-X-I, just T-E, isn't it, Leanne? Yeah, flaxite. And he said, no, you cannot have this flaxite, you just can't have it. And I said, I'm sorry, I'll go to America, because they do it in America. And so he said, oh, okay. And then 2 weeks later, yes, he located it in Adelaide. The Dr. Cow uses it. Thank you, Trudy. Oh, okay. The severed nerve. I couldn't feel my cheek. I just couldn't. He said, well, you're going to have that all your life. And a part of my lip. He said, well, you'll just have to, that's the form you sign before I
perform the operation. And he said, I'm sorry, I'll have to learn the anatomy of the body better, or something like that, he mumbled. He said, you're just going to have that the rest of your life. So you can imagine how I felt. I mean, I couldn't even kiss anybody and feel them. I just had no, truly, Ron, I had no feeling in my face at all, this side of my face.
During the surgery, part of the trigeminal nerve, a portion of it or a branch of it, was severed. From a medical point of view, this would leave her numbed in that area the rest of her life, and I want her to describe this to you.
Well, it was...
There are about 10 or 12 people not here when you went over that before, so go over it again, please.
Okay.
What part of the body was numb? Describe it.
Okay, the jawbone, all on the lower left jawbone, was completely numb. Because before he started... There. Before he started, he must have given me at least 20 injections, and it wouldn't deaden. And all I can think now that that entity did not want to come out. It would not go dead. He'd come in and he was quite worried. It finally went dead, and I've just explained what happened. Now, the cheek also was, all here, it was completely dead, and there was a great big lump. Then I arrived at Paul Bennett's place, and John said, sit down, I can see you're in a state. So he pressed between C3 and C4, and he said, you're going to feel pain. And boy, I felt pain. It was only for a minute. It was burning up through the jawbone. The jawbone came back, feeling in the jawbone started to come back. So he slid his finger up between C2 and C3, and the feeling in the whole feeling in my cheek returned. It was just a miracle. It was just, I just bless him every day I have since. It's just, nobody knows what it's like to have a dead face or half a dead face. Just incredible. Okay.
I think that's it on that. Any questions?
Root canal.
Okay, first of all, hang on. Any questions to Delwyn? No. Okay, Delwyn, thank you for sharing again. Andrea?
I'd just like to ask about crowns, whether once you have a crown fitted, the tooth is dead, it's reflecting to the organ. Whether it's better to have the tooth out or to keep the crown.
My understanding is that if you still have an actual living tooth where you've just lost some of the topmost part, but you still got the root and the nerve and all the rest are still alive, I would think you'd be much better off getting some sort of non-toxic crown placed on it as opposed to having the tooth off. The problem with the root canal is that you have the inner part that's been all, drilled out, where the living part of the tooth has been removed, and then they fill that with some material, and basically you have a little area in there that's a really wonderful little breeding ground for all sorts of bacteria and all. So you basically have this little microbe factory inside your head a couple inches from your brain that's continually pumping toxins into the system. A crown on a living tooth would in my opinion, would be preferable to getting that tooth pulled, provided the crown was not made of some type of toxic material like, involving amalgam or something.
Provided the filling underneath is not mercury, which sometimes they put in. Silver amalgam. Oh yes, they also found mercury under my crowns.
I just want to ask about root canals. Is it necessary to have the tooth removed if you have root canals, or can it be redone with something else?
I don't know. I am under the understanding at this point in time concerning root canals is because if the root canal is dead, you've got many miles of blood vessel in there, which is carrying the toxic conditions throughout the whole body due to what we call an anaerobic condition in there. And no matter what kind of a root canal you have, you're going to have an anaerobic condition there because there's no nerve supply to it. And then that throws you into a situation where you poison the whole body with your root canal. Now there may be something they'll come up with sometime or another where they won't have that problem, but I don't know what that's going to be. I'm going to have Anita talk to you now for just a moment.
We have this book here, which you could get more information. The Root Canal Cover-Up by George E. Menig. M-E-I-N-I-G. You can come up, anybody who's interested, come up and get the details later. This will probably answer a lot of your questions on root canals. The Root Canal Cover-Up by George E. Menig, M-E-I-N-I-G.
By the way, who left this book up here on the 5 rights? That's ours? I read it the other day, and I don't recommend reading this book. Okay? Put it away. Put the book away. We'll get the other out. Pardon me? I think I've got some to hand out a little later on, but I don't want this book. This guy doesn't know what he's talking about. He's very much into the base chakra area, and he doesn't understand the higher levels of the chakra system. This book I do not recommend at all. He's doing this for a purpose of using the 5 Tibetan rites to put forth his own distorted ideas, and I can't recommend it. Put it away. I don't want it. Don't want it even exposed. Okay, Ron.
John, can I ask a question from here because I'm holding my tape?
Yes, sir?
If an in-ear tooth with a root canal is bad for your teeth, therefore implants of teeth, if I have to get my front tooth removed and I want to be cosmetically nice and not have a plate, which I've had years ago in my life, driving up the wall, if I get an implanted tooth, which is an inert substance in my jawbone, is it going to do the same thing?
Usually you put titanium in there, into the jawbone, and then everything grows around it after you put that implant in. And as long as they're using that titanium, which is a metal, I'd be opposed to it. And I don't know if anything else foreign in there is going to be any different than your titanium. What I find is when you put something foreign into the body, and the body reaches a certain level of vibration rate, it rejects anything foreign.
I have a little trophy back home that John will probably remember from down in West Virginia. Trying to remember the fellow's name.
I know what you're talking about, the fellow
with the bees.
This fellow, first time I met him, he pulled a tarp off of a load of lumber, and pardon? Frank. And he pulled this tarp off and got stung by probably 1,000 bees, and it ended up in the hospital totally paralyzed, unable to walk, unable to think, with brain damage and the whole works, and he'd never be normal again. Here's the rest of the story.
Well, I didn't actually see this happen, but I had the story related to me by a number of people, including the gentleman's wife, and he apparently got on the program very, very thoroughly. I guess he was totally fresh and raw to the point where he took tin foil and covered up his stove at home so his wife couldn't even cook anymore. Went totally fresh and raw for a number of years and went through just tremendous healing crises. And came back from the state he'd been in originally, where he was partially paralyzed and all the rest. And I guess at one point along the line, prior to him being on the program, he'd had an operation on his hip there where he'd had this metal bracket, and he'd fallen down and broken his hip. So he'd had a metal bracket surgically implanted on his hip. And I actually have this back in Massachusetts. His wife gave it to me one time when I was down teaching a seminar there. And it's got about a 90-degree bend in it, and the two sides of the bracket, I'd say, have got to be about 4 inches long each. So it's a pretty good sized metal bracket, and then there's big screws like about 2 or 3 inches long that would have been attaching it into the skin, and into the bone, right into the bone. It's screwed right into the bone there. And apparently at one point, when he was very heavily on the program, his body went into such an extreme healing crisis that it literally started to reject the bracket, to where it worked loose from his bone and the skin opened up, and it was actually starting to come right out the side of his leg there. And I guess John was in town at the time, and he showed it to John, and I guess he actually had it taken out at the hospital, but I mean, it was basically his body was just getting ready to do the job. I mean, the skin had opened. The screw. The screws were already coming out and his body was just getting ready to chuck the whole lot right out.
By the way, after he had a stroke, you know, he couldn't talk. Frank, yeah. He's back talking again and walking again and living a normal life. I think he has a little...
He actually ended up getting cancer and then passing on.
Did Frank pass on?
I'm pretty certain.
That was 15 years ago. Time passes.
10, 12 years after that he passed on.
Yeah, he passed on maybe about 3 years ago.
Yeah.
So, but he had overcome all of this. Peter first.
So far,
Can't hear you, sir.
so far the situation with pregnant ladies with mercury. What come up with?
Works on the teeth problem of amalgam. They don't recommend that the pregnant lady should go near dental surgery. They're more in favour of leaving it until after the birth. Because if there's a lot of fillings, there's still a certain amount of ethyl mercury in that still goes into the body, and it does affect the fetus.
There's a book here, Infertility and Birth Defects Caused by Silver Amalgam. And here's all the evidence, all of the proof, and this is why they're looking for a mercury-free Austria by the year 2000. They're banning it in Denmark. They're looking at banning it in Germany and other countries in Scandinavia and elsewhere. But this is getting to be a very politically hot issue of getting the silver amalgam out. And the dentists here in Australia will have to bow their heads and realize that they've been making mistakes for years. And don't let them up on that. And get the information, pass it around. You have the information on mercury in the Blue Book. You're certainly free to copy that in any way you want to and get that out to your friends. But these are books, you can get the addresses, come up here and get these addresses and get them in your library. They're absolutely valid for our purposes. Yes?
There's another issue too with people that have false teeth or anything that's coloured pink. They normally put cadmium in that to give it the colour. And I've known of cases of people actually having cadmium poisoning through the false teeth, or even plates that are pink coloured.
Very good issue. This is the first I've heard of that. I can't hear you.
That's what I said about the flex side.
I can't hear you. Come up here.
Only material, it hasn't got the cadmium or anything else in it. It's the only material that's clear of anything.
Is that multicolored?
No, it's just clear.
Thank you very much. Let's take about a 15-minute break, get out and get some sunshine. Lady? Okay. Yeah, you tell your story.
Okay. I was in Germany 8 years ago. I lived there when I was pregnant. And when I was pregnant, I could not handle the thought of going to the dentist. So I went to the dentist after I gave birth. And the dentist said to me, well, we can't put amalgam in your teeth while you're breastfeeding. And they also weren't allowed to put gold in at the same time. You've got amalgam in your mouth. So they ripped the whole lot out, put gold in, and hardly cost me anything.
Thank you very much. Mick. Listen to what Mick has to say and learn from this gentleman. This is first-hand experience. And for counseling your patients, learn the principle here.
Forget the gentleman bit first, but since 12 o'clock the feeling wasn't in my teeth, but it's come back now, so amalgam must have stopped them. Thank you.
Now, how long have you not had the feeling? Years. And the thing is, now he has feeling back where he hasn't got it. It wasn't just from the Novocaine. Do you follow me? Where's Dr. Tom? Where's Tom?
Tom Bartlett.
No Tom Bartlett.
Just while we're on the subject of amalgam, I got all mine ripped out, and I've suffered a lot from manic depression, lack of motivation, like, you know, most of my life. And ever since I got my amalgams out, it was kind of like a weight lifted off my shoulders, and it just became really easy to smile again. I just want to share that with you.
Okay, question number 17. Do you drink or have you been drinking fluoridated water, using fluoride tablets, using fluoride mouthwashes, or fluoride toothpaste? Okay, the bottom line is the fluoride destroys the immune system. Make sure the fluoride is not in your toothpaste. And to get the fluoride 95 to 97% out of your water supply, you must get a reverse osmosis water purifier. The carbon filter will not take out the fluoride. Plain carbon filters. The carbon will take out chlorine, but not fluoride. We've got a book here, Fluoride, the Aging Factor, by John Yamianis, which is...
Definitely what it's about.
Doug's going to write this on the board. Yes.